This can be a very isolating experience, especially for those with dementia. It doesn't have to be. And so really knowing what resources are available and making sure that you're not only taking care of your loved one, but taking care of yourself.
America is facing a growing caregiving crisis. With healthcare worker shortages and dementia cases on the rise, more families are being forced to fill the gaps, often at enormous emotional and financial costs. For retirees, this has become an unavoidable reality. Many are now both giving and receiving care. My guest today is Dr. John McHugh from Virginia Commonwealth University, lead author of a new study showing that half of U.S. states are at critical or high risk of a caregiving emergency. John, welcome.
Thank you.
Pleasure to have you here. A little bit more table setting before we jump into the questions, if you don't mind. One is in a previous report that you wrote that there are some now 45 million people who serve as unpaid caregivers, representing almost $900 billion worth of labor each year. 2/3 of all those caregivers are women, and 2/3 of all caregivers are juggling not only their careers as well as caregiving. So let's start here, John, with the research that you did. You show that 48% of U.S. states are on the brink of a caregiving emergency. So for someone who is a caregiver today or who might become a caregiver in the future, what's the most important steps that they can take right now to prepare for that crisis?
Thanks. Yeah, I think the steps that they can take are really understanding the landscape. So one is understanding that there's a significant financial burden to caregiving. And so perhaps opening up a caregiver savings account. So as you think about retirement savings and you think about budgeting into the future, you may include caregiving as one of the line items that could potentially come up in the future. It could be a family account. It could be, an individual account that you really think about, where your loved ones are in kind of their journey of aging, and where caregiving may come into play down the road. Some other things you may think about are, the supply within your region or within the region of your loved ones. So supply varies in terms of institutional care, whether that be nursing home care, assisted living, but even home-based care. Quality of home health aides varies across states and across counties, across zip codes. So really understanding what's available. And then I think the third part would be understanding the policy environment. So understanding what's available within the particular state that your loved one is in, but then also for you personally, understanding what your employer is willing to give, what benefits are available for you to perhaps take time away for caregiving.
Yeah. In a previous report that you wrote, you also mentioned some other steps, including starting a conversation with loved ones, which seems to be the one thing that people avoid the most, and also exploring long-term care insurance options, which also is a sort of a high hurdle given either the cost involved or the premium hikes that are involved, et cetera. So maybe talk a little bit about starting that conversation. That seems really important too.
Yeah, I think understanding kind of the financial situation of your loved ones, understanding your own financial situation, starting that conversation of what the preferences are for your loved ones. So whether they would prefer to be kind of in a home environment, whether they are, would want to be in a nursing home or assisted living. But some of that also is contingent on the diagnosis that they have as they age, whether or not they are diagnosed with dementia, which can then become, a 24/7 caregiving experience, and is very, very intense. But really just having that conversation around preferences, around the economics of it, and really knowing what their wishes are and honoring that going forward.
Yeah. So when I think about the report that you just published, it notes that there are some states that are in a critical state of affairs with respect to caregiving, states like Florida and Georgia versus well-supported states like Minnesota. So what actions should I take as I contemplate my retirement or as I think about my parents' retirement and where they ought to live? I read the report, John, and I thought, well, I better move to a well-supported state so I can avoid living in a critical state. What advice do you have?
I think the critical versus well-supported nature, there's a lot of factors that fit into that. Some of that comes down to, housing, how affordable is the housing within that state and what percent of a family budget is going towards housing. Other factors that go in are the supply and quality of home health aides, and kind of the paid workforce. Other factors are the overall quality of the long-term care supports and services. So really, there's a lot of nuance to it. And I think, from a retirement perspective, I would say go with the preferences of where you want to be first. But I would also say really consider, what the supply looks like as you age. Is this a place where you can age gracefully? Or is it a place where you are going to face significant hurdles if you have some sort of crisis? And are your loved ones going to be able to take care of you as you age in place?
Yeah.
So it definitely should be part of the calculus. But I don't know that it should be the first thing that you really think about. But I think it's one of those things where state to state, policies change, quality of healthcare changes, and so you may be in a critical state now, but there may be some policy changes or some supply changes that really affect the long-term situation.
Yeah. And what about the cuts in Medicaid and how that might affect states and what sort of action states might take, who might be in the critical zone or sort of on the verge of being in the critical zone if these Medicaid cuts do affect them?
So I think where Medicaid cuts come into play is that when you think about unpaid caregiving, you cannot decouple unpaid caregiving from paid caregiving. And so as any cuts affect the supply and quality of long-term care, that's going to put more and more pressure on the unpaid caregiving workforce. So as families have a harder time finding high quality home health aides, if nursing homes are shutting down, we're seeing, rural hospitals are really in crisis. And so as that continues to play out, the quality and access for healthcare services, if that declines, you're going to put more pressure on families to take care of their loved ones as they age.
Yeah. In the report, you mentioned that rural states are sort of most at risk in terms of caregivers and their access to healthcare workers. For those rural listeners, what options do they have? What kind of strategies can they, employ to access support and resources?
I think what first and foremost, really understanding the supply of paid workers. So understanding what's available. This is where really understanding the policy environment comes into play. So if there are certain tax credits for in a given state for family caregiving, really understanding your own employer benefit packages. But also, caregiving is something that there was research that was done that showed that as the intensity of caregiving increases, the number of people involved also increases. So it takes a village. So there may be additional resources just within your community, whether that be support groups, whether that be church groups, whether that be other aspects of your community that you can tap into that can help you along that journey. So really understanding the resources available will be help people be effective in taking care of their loved ones and handling the crisis.
Yeah. So that sounds hopeful that there are resources, but yet at the same time, many feel abandoned in this process, right? They don't know where to turn to. How did we get here that so many people feel abandoned in light of all those resources that you just mentioned?
I think there's a few things at play here. One is caregiving can come on in a moment. So you could be fine one day, and then the next day you're hit with this crisis, and it can be very isolating. And unless you've kind of planned ahead of understanding what those resources are, you're scrambling. You're scrambling as a family. You're scrambling as an individual. In a conversation that I had with Liz O'Donnell, who was the founder of Working Daughter, she was faced with 3 different diagnoses within a year. Two cancer diagnoses, and then her father was diagnosed with dementia. And so, she described it as a very isolating experience. And what was interesting was that she was able to manage the first 2, but it was really the dementia diagnosis that brought her to her knees. And I think that's where, really understanding what's available, really tapping into those resources that are available, and having those advanced conversations to really plan out what that future looks like.
John, we're going to take a short break, and when we come back, we'll share some more practical ways that you can navigate these resources, manage costs, and protect your family's future. So don't go away. Welcome back to Decoding Retirement. I'm speaking with Dr. John McHugh. He is a professor at Virginia Commonwealth University and author of a study called America's Unseen Workforce, the State of Family Caregiving. John, we were talking about dementia, and I'm curious if there's any training or certification programs that family members could avail themselves of before they enter crisis mode, just to get better prepared for the possibility of this happening.
Yeah, so dementia is one of the key priorities within CMS, and so there are some programs available now in which families can get tapped into. So one of them being the GUIDE model, which stands for Guiding an Improved Dementia Experience. It's for community-based Medicare beneficiaries. Their physician would have signed up as a GUIDE participant, and there are a lot of different programs. And essentially, what they do is kind of provide a navigated experience through dementia care. There are a lot of areas where individual health systems may provide specific resources around dementia care. Years ago, I was talking to one in particular, doing some interviews for another research project, and they were talking about how they had implemented a caregiver, what they call the caregiver bundle, to really understand caregiver stress, and provide resources for individuals that were caring for a loved one. So I think understanding as we talked about before, understanding the resources available in your local market really helps. And as some of these programs through the federal government, through CMS, start to expand, we'll start to see more and more resources available at the local level. Beyond that, it's really comes down to, as we've been talking about, financial planning, and really understanding kind of what's available from a workplace benefit perspective, what may be available in terms of tax credits, what may work in terms of long-term care insurance. So really understanding kind of the financial planning aspect of it. And then lastly, the legal side. So understanding, power of attorney, making sure, wills are in order, those types of things. So, there may be local trainings around that aspect of it. There may be local trainings around the financial planning aspect of it. And there's a number of interventions that are being tested within CMS, kind of within the community to improve care and care coordination for those with dementia.
Yeah. I also think about, in terms of local resources, your senior center or your local area agency on aging, or
Absolutely.
yeah. And then there's some national groups like the National Alliance of Caregivers, I think it is. Is that one of them is also a potential resource, as is maybe the Alzheimer's Association?
Alzheimer's Association has produced a lot of great reports. National Alliance for Caregiving, Caregiver Action Network. So all of these, as I mentioned before, Working Daughter, all of these are great resources for individuals to really tap into, because, as I said before, this can be a very isolating experience. especially for those with dementia. It doesn't have to be. And so really knowing what resources are available and making sure that you're not only taking care of your loved one, but taking care of yourself too. Because that the emotional toll of caring for someone with dementia is big.
Yeah.
And so making sure that you're taking time to reset and refresh will help you and will help your loved ones.
Yeah, I believe volunteers for villages can also play a role in
Mhm.
that as well. So
Absolutely.
I want to move on. You mentioned sort of the financial aspects of this, and in one of your research reports, it mentions that younger caregivers are at risk of facing a 40 to 90% deficit in retirement savings by age 65 by providing care, and that to make up the difference, they would have to work an astounding 7 to 21 years longer to make up the difference. That's like a mind-blowing fact. I can't even get my heads around that one.
Yeah, it was a very simple calculation. We looked at just at a given at a given income. If someone left the workforce, and you have to remember that if you leave the workforce, you're foregoing any sort of 401k match. And so if you're a young worker who's then foregoing that match and your own contribution and perhaps taking on some debt to care for a loved one, um, the cycle just perpetuates. And so, you're going to miss out on, potential um, uh, advancement within an organization. You're missing out on the compounding factor of any of those contributions that you make at an early age. And it quickly explodes into what could be an additional, 10 to 20 years of work to just catch up. So, I think for individuals really understanding that, take advantage of all of those opportunities early on to maximize what you're putting away, because you don't know when this may come to pass that you would have to take some time out for caregiving. Um, and also, as we talked about at the beginning, thinking about perhaps, budgeting into any sort of kind of rainy day fund, the potential for caregiving. Um, and if you never have to use it, then you've saved some additional money.
Yeah.
So that's also a good thing.
It's so interesting when I talk to caregivers, despite the cost, the financial cost to them, many often say that they would not have had it otherwise, that the time they spent providing care to a
Yes.
loved one is something that you don't get back, especially if the one that you're providing care to passes on.
Yeah, I think, that in talking to a lot of other researchers in this area, that is something that they have found as well, that, yes, it was a great burden, but I would not have changed anything.
Yeah.
That it did provide them with that time. Um, and so, the value of that is you can't really put a value on it.
Yeah.
So, it definitely is worth maybe that short-term expense. Um, but the more that you can plan for it and have some more protection, financial protection, and cushion, um, the more value you can extract from it because you're not providing care and getting that value, but also, worrying about the financial aspects of it. So, planning ahead and really understanding what it takes, is, is a great step.
Yeah. So, John, you mentioned the employers a little bit ago. Is it your thought that if there aren't employee benefits that would help workers leave the workforce to do this kind of care, that they should talk to their HR employee benefit department about maybe having such policies put in place?
It's worth a conversation. Yeah, no, I think, employers are more and more getting involved in this, and providing maybe some more flexible benefits to allow people to take time off for caregiving, and just redefining what kind of time off is, and, perhaps sick time could include taking some time off for a caregiver. Um, you know, the the way to tackle this is going to happen at three levels. There's the federal level, there's the state level, and there's the employer level. All three of them really have to work together um, to be supporting caregivers through this process.
Yeah. So as you look into your crystal ball, America is aging. More and more people are in that category now. The possibility that more people will need caregiving seems like it's likely on the rise. What's your outlook? Is it going to get better or worse or stay the same? And what hope or lack thereof do you have for folks?
I think I always have hope. So, um, I think I think the fact that we're having the conversations always helps. And so I think the more that we put this out into the under the spotlight, um, I think, as we saw during the pandemic, there was a big light that was shining on our long-term care issues within the United States. And I think that helped to shine a light on the fact that there's this invisible workforce that's been working behind the scenes for many, many years to care for their loved ones. So the more that we can kind of put this out into the open, the more that people are having the conversations, the more that employers are understanding that this can be a benefit to their employees, the more that um, our local and national representatives really understand that this is a big issue to tackle, the better. So given that, I do have some hope that we will start to address it. I think there's a lot that needs to be done in terms of shoring up um, our long-term care workforce, the quality of our long-term care, how we pay for long-term care. All of these things need to be shifted. And we are at this crossroads where we can kind of choose the path that is supportive of individuals and caregivers, or we can choose a different path that's not. And I like to hope that we'll choose the right path.
Well, I, for one, am thankful for that dose of hopefulness, John. Much appreciated. And unfortunately, we've run out of time, and I want to thank you for sharing your knowledge and wisdom with us today. It's greatly appreciated. I'm sure it will help a good many people who watch and listen to the podcast today.
Thanks for having me, Bob.
A pleasure. So that wraps up this episode of Decoding Retirement. We hope we provided you with some actionable advice to help you plan for or live in retirement. And don't forget, you can listen to and subscribe to Decoding Retirement wherever you listen to your favorite podcasts.
This content was not intended to be financial advice and should not be used as a substitute for professional financial services.